James.
Hi.
Hi, it's nice to meet you. My name is Sarah. I'll be your medical assistant today. So it looks like I'm getting you set up for surgery intake. Is that right?
That's right.
Perfect. Okay. So let's go ahead and get started. I have a couple things. We're going to go over some paperwork that I'll have you sign. We're going to go over your mobility status, which just is a convoluted term for are you able to move around and do stuff on your own. I have a couple of supplies that I'm going to get you set up with, and then your nurse will come in and she'll do your pre-op intake, okay?
All right, sounds good.
Perfect. So how are you feeling today?
Not bad.
Excited? Ready to get it over with? Yeah. Okay. Okay, well, like I said, my name is Sarah. I'll write that up for you. If you need to call me, you can use your call light to page me. My pager number is 68995. Okay, and you look pretty independent, I would guess, at a baseline. Are you able to still complete all of your tasks at home independently? Like you get dressed by yourself, your injury isn't causing you any issues with your mobility? Okay, so we'll go ahead and say that you're independent. If at any point you feel like you need help getting up to use the restroom or anything like that, please hit your call it and someone will come in to help you, okay? Okay, so I will be getting your vital signs. We'll do that a little bit later. I also do need to get a COVID test done on you. It's just part of the pre-op. I know, it's not everyone's favorite thing. I totally get it. So let's go over your chart. Looks like Dr. Perez has a couple consent forms here for you to sign, so I'll go over these with you. And just a formality, can you spell your last name for me?
Sure. M-O-N-R-O-E.
Perfect. And what about your date of birth?
Date of birth is 11/17/1991.
Perfect. Okay, and just before your surgery, the nurse and the doctor will go over the consent form with you again. They'll make sure that the site is marked correctly. Obviously, we want to make sure we're not performing surgery on an incorrect place, so this will be gone over with you again, but just as an initial part of the intake, it looks like you're having surgery on your left arm. Okay, and this is, looks like 1 day inpatient, so you'll be staying overnight and then have your surgery in the morning.
Okay.
And it looks like you'll be heading out a couple hours after that, pending everything goes well. Gotcha. Okay. So I'm going to have you initial here for me. This is just stating that you agree. And then one more time. That one is just a HIPAA policy.
Okay.
And do you have any belongings that we need to inventory for you?
My cell phone.
Cell phone?
And my wallet, that's all. All my keys.
Keys.
Yeah.
Perfect. And glasses?
And my glasses, yeah.
Do you have a cell phone charger?
No, I don't.
Okay, no charger. Should you need one, we do have some at the front desk, so just let me know. All of that we will have inventoried for you. Once we take it, we'll take it right before your surgery. We'll have you sign a consent form, and then when you get out of surgery, we'll have you sign it back out. Perfect. Okay, so I'm just going to have you initial here, and this is just stating that we've inventoried your belongings. Thank you. Okay. Does it look like... Okay, last one, and this is just consent for the COVID testing.
Okay.
Perfect. No COVID symptoms or anything in the last 14 days? Okay. And you haven't traveled out of the country or anything? Okay. All right, James, well, let's go ahead and get started. I have a bunch of things here for you. So we have a little nausea bag in case you start to get nauseous. I also have a pair of socks for you, and these are a surgical requirement, so the nurse will have you put these on right before you go to your surgery.
Okay.
Also also have a little deodorizing spray, face mask, a little bag you can put on your bedside table for trash. Nasal cannula that I will actually be putting on you now. Some oral care supplies so you can brush your teeth. And then we also have the CHG wipes, which I'll go over with you.
Okay.
So I will set this stuff here. You're welcome to come grab it whenever you need. The restroom is right over there. Okay, so let's go ahead and get started with your vital signs. So I am going to go ahead and come around. All right, James, so let's go ahead and do your COVID test. And I am so sorry. So with a little swab, you're welcome to close your eyes. I know it's uncomfortable. I'm going to start with this side. Okay. Very good. Moving to the other side. Okay, I'm sorry, we're all done.
Okay.
So I will get this processed and we'll send your results off to the lab.
Okay.
And let's go ahead and take your vitals. So I have a thermometer here. I'm going to do under the tongue. Perfect. Do you mind holding on to that for me? There you go. Okay, let me have a look. It should be done. 97.8, perfect. No fever. I'm gonna go ahead and take your blood pressure. Do you have a preference what side we take it on?
I guess the same.
Okay. A little tight. Okay, relax your arm for me and I will get that connected. And we'll check your oxygen on the other side. Perfect. And I am going to start you on a nasal cannula. This is just part of your doctor's requirements. We want to make sure that your oxygen is being supplemented before we get you in surgery. So you will wear this all night. Can be a little itchy on the nose. Let me know if it's uncomfortable. We can ask if it's okay to do without it, okay?
Sure.
A little more. Very low flow. It's just supplemental, like I said.
Okay.
Does that feel okay?
That's fine.
Okay. I will get that connected for you. Okay, it looks like your oxygen is perfect, 99%. No complaints there. And blood pressure is also all done. 132/78, which is good. So I'll leave these in here. Obviously, we will be checking them periodically. And James, the last thing I just want to show you is these chlorhexidine wipes. We will need to do this twice, unfortunately. So tonight when you take a shower, you're going to shower regularly, regular soap. There's supplies in the restroom. I do need you to use these. Have you ever used these before?
No, I haven't.
Okay. So it's a pack of 3. Each one comes with 2 wipes. And you need to use all 6 of them. You're going to avoid using this on your face or your private area, but everywhere else you want to use it. If you need help with your back, let me know. I can come in and help you with that. Okay. It's 1 wipe per area, so there are directions on here. Basically, you're going to use 1 for this arm, 1 for this arm, 1 for your chest, so that's 3, 1 for your stomach and your back, and then 1 for each leg.
Gotcha.
Okay. Like I said, if you need help, let me know. We do have a special lotion that you can use with this. No other lotions are approved, unfortunately. They do deactivate the CHG. It's just an antimicrobial. We're trying to decrease any bacteria before you go into your surgery. And like I said, you will need to use this again in the morning.
Right.
So the nurse will come in and help you do it again before pre-op, okay?
Sure.
So I'll leave these here for you. Like I said, after you shower, get that done. When you do, let your night shift nurse know just so we can check it out for you.
Okay.
Okay?
Yep.
Okay, well, that's all I have for you. Do you have any questions for me? Okay. Well, like I said, the nurse will be coming in. Your night shift nurse name is also Sarah, coincidentally. She's very nice. She'll help you get settled and do a little more in-depth with your pre-op needs. And then in the morning, good luck with your surgery.
Thank you so much.
Okay, no problem. Have a good night.
You too.
Call if you need anything, okay?
Okay.